Hello everyone. Today we will be discussing about the bone marrow examination procedure. The clinician might ask you to undergo a bone marrow examination procedure to understand the reason for, in particularly, reduction in the blood cell counts. Now, for every individual, though it is age defined, the range of the blood cell counts is very much understood. But whenever the blood cell counts either fall short of that range or are beyond that range, then that needs to be evaluated. Unless the reactive causes have been ruled out, reactive in the sense if the patient is having a known cause for a fever, like he has some infection, those things are ruled out. Apart from that, if there is some unexplained causes for persistent elevation or reduction of the blood cell counts, then that individual is usually advised to undergo a bone marrow examination. Now, why is this bone marrow examination advised? Now, because all these blood cells, before coming into the peripheral blood, they are synthesized or produced inside the bone marrow. This bone marrow is situated in between the all bones, whether it be a flat bone or long bone, and depending on the age, it has its activity at certain points. Now, these blood cells, when they develop and they mature, and it takes a period of time, and after they attain the maturity, these blood cells get pushed out into the bloodstream, so that these blood cells are then circulating in the veins and arteries. Now, or after a certain period of time of their shelf life, or we should say their lifespan, they are taken out of the body. Now, if this balance of production and taking away from the body is maintained, then the cell counts are maintained within the estimated range. But whenever either a lag in production or a lag in destruction or the taking off of the cells happen, then there would be an unjustified elevation or reduction of the blood cell counts. So just to understand whether these are the culprits where that has led to the increase or decrease of the blood counts, the bone marrow examination could be one of the potential diagnostic modality to understand whether the bone marrow functioning is appropriate or not. It might be normal in most of the cases, even though the cell counts are low or high, but it could at least give a confidence to the clinician that the bone marrow is need not to be the worrisome factor here, and the further evaluation for other causes can be done. So, with this pretext, let us understand how the bone marrow examination procedure is done. So, during the procedure, we usually select a place called posterior superior iliac spine, which is relatively broader and is easily accessible, so as to acquire the blood bone marrow sample. And then, before the procedure, we would like to have the complete history of the patient, the relevant investigations. We would like to have a look over it, and then after taking proper consent and explaining the patient about the usefulness and the overall benefit of this test, so as to his diagnostic workup, we would further go for the bone marrow examination procedure. During this, we would ask the patient to lay down in either left lateral position or right lateral position, depending on the laterality on which we are going to perform the test. And after that, in certain positioning, we would maintain the patient, and then we would clean the area before undergoing the procedure. We would clean the area by antiseptic solutions. After that, we would inject local anesthesia to infiltrate into the skin through the soft tissue and up to the cover or the bone, because these are the areas where nerve endings are there, and those could be sensitive for pain. So these things are made numb so that we can later on introduce our bone marrow aspiration and biopsy needles, so that the procedure could be overall less painful to the patient. So after injecting the local anesthetic, we would wait for some time so that the anesthetic should take its action. After that, we would put a small nick onto the skin, and that nick could be very small in size, must say around 2 mm of size, so that it doesn't need any resuturing after the procedure has ended. So it could heal by itself because it's a clean type. Through that skin puncture, we would introduce our bone marrow aspiration needle and would take out some amount of sample that we would aspirate and place it on the slides so as to examine the cells which have been in that content. And also we would at the same time would take an additional amount of sample and we would preserve them in EDTA vials and heparin vials, so that if some abnormality has been found in these bone marrow aspirate on examination of the slides, the extra sample that we have taken could be used for performing some additional tests if required, depending on the conditions. After the bone marrow aspiration has been done, we take out the aspiration needle and then we can use the bone marrow biopsy needle, which we would again use the same skin portal for entry. And after that, we would take the bone marrow biopsy. The biopsy meaning by the same bone marrow is taken out in a piece-like manner, and that could be put in a formalin solution so that it hardens and is amenable for histopathologic processing. So both the bone marrow aspiration and the bone marrow biopsy are both studied together so as to get an idea of what the disease pathology, if any, is there, or if the bone marrow is behaving normally or as expected. So this is about the procedure. So the report format would go as the bone marrow aspiration, in which ideally one should tell about the peripheral blood reporting, as well as how does the peripheral blood smear looks like. And then we would enumerate the number of cells, how many we found, that how many of the myeloid lineage cells, how many erythroid lineage cells are there, and then did we see any abnormal cells in that. If abnormal cells are found, then we try to characterize them morphologically initially on bone marrow aspirate. To further characterize which type of cell it is, we need additional tests like flow cytometry, for which the additional sample has been taken during the procedure. So here is the case when those additional samples would come to our help so as to understand which type of cells, abnormal cells these are. And after that, we would try to give, we would also mention the pulse score, which states the amount of iron storage in the patient. And because bone marrow aspiration is a very true indicator of how the bone marrow or how the body iron storage are there. So we would take this opportunity to mention that as well. And as an impression, we would try to give our opinion as to what the bone marrow is like. So whether it corroborates with the clinical findings or does it provide some meaningful insight to it. And then accordingly to bone marrow biopsy is also examined, and that is also been described in terms of how the erythroid lineage, how the myeloid lineage, and how the platelet precursors are there in the bone marrow biopsy. And then it would be followed by an impression stating the opinion how the bone marrow biopsy is. So post the procedure, though the patient is usually advised to be under observation for around half an hour to 45 minutes, and after that the patient might observe for a while that how is he doing, and we would just see that there is no excess of bleeding happening, and then the patient is allowed to go home with on and off analgesic if required. Then this is about the procedure of bone marrow biopsy and aspiration, and how does the procedure is made to happen, and how does the reporting happens. The implication of this would be this report could help the clinician understand whether the bone marrow is the culprit where these cells are being not maintained in the normal range. If the bone marrow is completely normal, then the clinician would explore the other reasons for which the cell counts might have changed or might have fallen out of the range. So this is about the bone marrow examination procedure. Hope this video finds you helpful, and see you next time. Thank you.